So I'm back here in the same anatomy lab, same shirt, so same day, but I'm going to go ahead and do a recording on the axial skeleton for you. So that way then you will, again, have access to what I would show you in lab if you were here with me in-house. So really quick, we're going to go through exercise 9. Exercise 9 goes through the axial skeleton. And really, the axial skeleton is everything that's not the appendicular skeleton. So the appendicular skeleton is going to be your limbs, so your arms, the bones of the arms, the bones of the legs, and then whatever attaches those bones to the axial skeleton. So the pectoral girdle, for example, here, which is going to include your clavicle and your scapula, that's going to be all part of the appendicular skeleton. Same with, as you look here, for the leg, part of the pelvic girdle, like the os coxa here, is going to attach the lower limb to the axial skeleton. So that's all part of the appendicular skeleton. So basically, the axial skeleton is everything else. The axial skeleton is going to be the skull. It's going to be the vertebral column, okay, all the way down, including this bone, the very bottom bone here, called the sacrum, and the coccyx. And then it's also going to include the thoracic cage. So you're going to have the ribs here, and then the sternum. So that's going to be the axial skeleton. Oh, and one other bone here, this little tricky bone here, if I can zoom in, called the hyoid bone. That will be for the purpose of muscle attachment. So the hyoid bone, if you can see that here, is this bone right here. Kind of looks like a Dracula skull there. I mean, a Dracula mandible there. So that's the hyoid bone. And that bone is just going to be for muscle attachment. So I don't think we talked too much about the hyoid bone, but I'll get into it more in lecture. So when we talk about the skull is probably the most difficult for the bones of the axial skeleton. And so the great part is here in the lab, we have these lovely colored skulls, which will actually show you all of the cranial bones and all of the facial bones in color. It's a little easier to differentiate them that way. So what I'm going to do is I'm just going to go through your list of the bones. And so when you break up the bones of the skull, you can break it up into the cranial bones, and the cranial bones are going to be the bones that house the brain. So any of the bones here that are housing the brain, as well as internally here. So I'm going to briefly go through the cranial bones, and then I'll go back and go through the sutures, where the bones, remember these are flat bones that are connected now by these sutures. So let me go ahead and go through your cranial bones. So the first cranial bone you have is the frontal bone. So frontal bone's pretty easy for most students to identify, right? Then you have parietal bones. So in green, if you can see here, in green, a parietal bone here, and then on the other side, parietal bones. Then you have the temporal bones. So the temporal bones are here in brown. Here's the temporal bone. They actually, a lot of people don't know this, the temporal bone actually extends here and meets up with the zygomatic bone. So this part here, I don't believe you have to know it, but this part here is actually called the zygomatic process of the temporal bone, because it's this process that sticks out and meets up with the zygomatic bone. And this part right here is actually called the temporal process of the zygomatic bone. And again, they fuse here to make this zygomatic process. So when you think of the zygomatic or the cheekbone, the zygomatic process, it's actually made up of two bones, the temporal bone here and then the zygomatic bone here. It's just kind of interesting fact for you. But anyway, sorry, back to the cranial bones, not to confuse you. Again, you have the frontal bone, you have the parietal bones in green here, you have the temporal bones in brown here, and then in the back here, you probably know the occipital bone. What you probably don't know is these two cranial bones, because they're a little trickier and they're inside, mostly inside on the underside of the skull, or on the underside of the brain, is where you would see these. So if you look here, you have what's called the sphenoid bone. The sphenoid bone is going to be in red here. It looks kind of like a butterfly. Okay. And it's going to have this little thing here. It looks like a saddle. We call it the sella turcica, and that actually is going to house the pituitary gland. So just I'm giving you that information because we'll talk about the pituitary gland a little later on in the semester, and so that is the purpose of this little saddle. But again, this whole bone, and if you were to take this bone out, it's kind of cool. If you took this bone out, it looks like this. So this is the whole sphenoid bone here. So you can see you have these fissures that are going to be actually in the orbits, these orbital fissures here. So one of them we call the superior orbital fissure, but again, you don't have to know that, so I won't get into that. But what I want you to see is that the sphenoid bone not only runs just here on the underside of the brain, but it runs all the way into the orbit here. So in the red here is the sphenoid bone, you can see. So you get a good look at that. So again, the sphenoid bone is one of the cranial bones, okay? And then there's another tricky cranial bone. This is the last one, and this is the ethmoid bone. And the ethmoid bone is in yellow here. And you can see, when you look at the ethmoid bone, there are going to be these little tiny kind of holes on the sides, and we call that actually the cribriform plate, and that's actually where the olfactory nerves are going to run to innervate the brain. So kind of cool fact about the ethmoid bone. But the ethmoid bone, again, and I actually can show you it's cool because I do have these models. So this is what the ethmoid bone looks like if you pull it out. And there are actually sinuses, because we have what are called the ethmoid sinuses. So these would be these little air-filled cavities. You probably can't see it all that well because I'm getting a glare. But inside the ethmoid bone, if you were to pull it out separately. But the cool part about this is that you can actually see this little part that sticks up called the crista galli. And then on either side of that, you have these little bony plates with holes in them that we call the cribriform plate. And again, that is where the olfactory nerves will run through. So this, okay, if I were to pull it out, sits just like this. So again, ethmoid bone here. The other important thing about the ethmoid bone is that it's going to have this piece right here that's going to run down. If you see, it kind of sticks out and runs down the middle, and this will be on the inferior side of the bone. So this is the superior side with the cribriform plate, and this is the inferior side. And this little piece, this middle piece called the perpendicular plate right here that sticks out, that piece is going to be inside here in the middle here. And I'm going to try to put my pointer right on it for you so you can see it, because it's hard to see. But it's going to run right in the middle, and it's going to meet up with the vomer. So it's actually going to make up part of the nasal septum. So if you look again, I'm trying to get this angled right. There. So if you look right in there, that yellow, I keep turning my hand the wrong way, that yellow inside there where it's sticking up, let me get my pointer on it again because it is really hard to see. This is where I wish I had you in lab with me. So in that little center piece, there's a little part of it that's yellow, and it's going to meet up with the vomer bone, which is the larger bone here, and they fuse together to form the nasal septum. So that middle bone here is mostly vomer, and then right there is part of the ethmoid bone. So the two together are going to make up your nasal septum. So hopefully you can see that. I was trying to show you that as well as I could. So you can see that. Then you can also see that there's going to be a little portion of the ethmoid bone that you're going to see right here in yellow. So when you're looking at the orbit, right, you're going to see the sphenoid bone in red back here in the orbit. Then you're going to see the ethmoid bone in yellow here. And then the lacrimal bones are actually going to be up front here. So, and we haven't gotten to those. Sorry, I know I'm getting kind of ahead of myself, but I just wanted to show you all those while I was in there in the orbit. So you're going to see that the orbit of the eye is actually going to be made up of quite a few different bones, and I'll kind of cover those in just a minute. So again, cranial bones are going to be the frontal bone and 2 parietal bones. So, oops, to go back over this, frontal bone, 2 parietal bones, the temporal bones, 2 temporal bones on either side, temporal bones in brown, the occipital bone in blue, and then in red you have the sphenoid bone, again on the inside, and then in yellow, your sphenoid bone, in yellow you're going to have the ethmoid bone. So hopefully that'll help you in terms of identifying your cranial bones. Now let's quickly go into the facial bones. I can get my skull back together here. So facial bones are, wow, I'm really having trouble getting the skull back together. Okay, so facial bones here will cover sutures. Actually, hold on really quick. Let me cover sutures before I get ahead of myself. So sutures are pretty easy as well, and mainly because most of them are named after, if you know your planes, you're going to know your sutures. So if you're looking at the skull here, this right here is going to be the coronal suture, which makes sense because, again, it's on the coronal plane. So this coronal suture is going to separate the frontal bone and the parietal bones here. Coronal suture, okay? Then you have your sagittal suture, which is going to be in between here. The sagittal suture will be in between the 2 parietal bones. And again, it's going to be in the sagittal. Here, if you have the skull, it's in the sagittal plane, okay? So sagittal suture, very easy. The back one, I'm going to help you out with this one because this one usually is kind of tricky for a lot of students. But the easy way to remember this is the suture here looks like the Greek lambda. So if you look here, it looks like the Greek lambda. So right here, this suture is called the lambdoidal suture, and it's between the occipital bone and the parietal bones here. So here is your lambdoidal suture, lambdoidal. And then you have the squamosal suture. And the squamosal suture is going to be mostly between your temporal bones here and your parietal. So here is the squamosal suture right here. So again, mostly between your temporal and your parietal bones. Okay, now we're on to facial bones. And facial bones aren't too hard because you don't have to know too many of them. So first facial bone that you need to know is the maxillary bones. These 2 bones that fuse in the center here, the maxillary bones in orange. So you can see those in orange. Now I'm going to go ahead and show you the underside here because you can see the maxillary bone extends in orange here, okay? So if I were to take this lower jaw and put it off on the side, you can see that, okay? So there's the maxillary bones in orange, and they extend down here because a lot of people think this whole bone down here is the palatine bone, and it's not. Again, part of it is the maxillary bone. So the palatine bone, I might as well go ahead and just do that one. I know it's a little farther down in your list. The palatine bones are these 2 bones here that kind of form the most posterior part of the hard palate. So here in this skull, they're going to be pink, if you can see them. Those are the palatine bones. There you go, in pink. And then let's go ahead and move around here. Try to be careful with my skull. Let's see. So you do have to know that I already introduced the zygomatic bones. Oops, take the mandible off. So here are the zygomatic bones in purple. Zygomatic bones in purple. The nasal bones are going to be these 2 bones here. So here and here are your nasal bones. They're kind of a tannish color here, so the very tip. And those are going to form the kind of proximal bridge of your nose back here. Let's see. The inferior nasal conchae, of course, these are going to be a little bit harder for me to get at. The inferior nasal conchae are going to be these bones right down here. And let me get my pointer on it. So those bones inside there, they're gonna, I think they have them marked as kind of gray. And again, they're really hard to see. Let's see, there. So they're gonna be at the bottom here. So they're gonna be those bones at the very, very bottom. And they kind of stick out into the nasal cavity. And we'll talk about why that is. That's going to have a purpose for increasing surface area and increasing absorption of moisture and into the surrounding air as it enters the airways. So again, we'll talk a little bit more about that in terms of filtering the air as it enters the nasal cavities and also helping to keep the moisture as well. So again, those are, and you'll see there's ones above it. The ones above it are the middle nasal conchae. So you have there at the very bottom, okay, you have the inferior nasal conchae. Again, these are these two bones that kind of stick out into the nasal cavity on the sides there. And so you can see there and there. And there's the inferior nasal conchae, which are their own separate bone. And then the ones in the middle there, so right above it, you can't see the superior nasal conchae. So there you only see the two that are sticking out into the nasal cavity there. So the middle nasal conchae are actually part of the ethmoid bone. So, and they stick out on the sides here. So here, these are actually the middle nasal conchae that stick down and stick out into your nasal cavity there. So again, so you have your middle nasal conchae, which I don't think you have to know. Those are part of the ethmoid bone. And then you have the inferior nasal conchae, which are those bones on the side at the bottom there. So hopefully you guys can see that. I know it's really hard. If you're following along in your book, it should be pretty easy for you to see that now in the skull. And then you have, we did the palatine bones. Again, back here, there's the palatine bones. And then we have the mandible, which I took off so you could see. But here is the bones of the mandible here. So there's the mandible. Again, I took it off, and just forming the lower jaw. And then we already did the vomer. So again, the vomer is just going to be this bone again, sticking up here into the center to meet up with the perpendicular plate of the ethmoid bone to make your nasal septum. Okay? So those are, oh, my poor skull here. Those are the bones that you need to know of the skull. Now, one thing that I think students find really confusing, and that's why I'm going to go ahead and pull it up here on the fetal skull, is to show you that the fontanelles, when we're talking about fontanelles are only on the fetal skulls, okay? You're not going to see fontanelles on an adult skull because they're closed, right? They're fused and they're now sutures. So you only have these fontanelles on the fetus skull. And again, this is so that it makes it easier for the fetus to be able to move through the birth canal as, you know, the baby during the birthing process. So these fontanelles are going to close, and by usually it's about 6 to 8 months in age, these fontanelles will start to close. And the last one to close is that anterior fontanelle. That's why we call it the soft spot. And so really by 18 months, you have your fontanelles are all fused. So, or your fontanelles are all closed. So again, just to give you a little bit of clarification on that, because for some reason on every quiz that happens on the adult skull will mark the sutures, and people always put in fontanelles. And again, they're only going to be on these infant skulls. So that's the only place that you're going to see them. So really quickly, it's pretty easy to do. This one, the soft spot, is the easiest. That's the anterior fontanelle. Or you can also call it the frontal fontanelle, but mostly we call it the anterior fontanelle. That's the one that we call the soft spot. Then you're going to have here, back here, the posterior fontanelle. So that one's going to be right here. And, or you can also call that one the occipital fontanelle. So you'll see that one will be right. I don't know how well you can see that if it's getting kind of washed out with my glare, but hopefully you can see that right there. And then you have these two fontanelles on the side. So one here and then one back here. So you can either call them the anterolateral fontanelle because it's more anterior, and the posterolateral fontanelle, or I like to call them, just because they are more associated closely with the bones that they're near, the sphenoidal fontanelle. So the anterolateral or sphenoidal, like the sphenoid bone, sphenoidal fontanelle. And then you have the posterolateral fontanelle or the mastoid fontanelle. So pretty easy in terms of fontanelles. And I believe we have images on the link for the lab to the actual infant skulls, fetal skulls, so that you can see all these fontanelles. So again, anterior fontanelle, posterior fontanelle, anterolateral fontanelle, or you can call it the sphenoidal fontanelle, and here the posterolateral or the mastoid fontanelle. So that's it for fontanelles. So let me see what else we need to cover. The vertebral column. So I'm not going to cover the vertebra because I have a separate lab where I use the GoPro camera and kind of zoom in on the different types of vertebra. So hopefully that will really help you out. But you can see, I'm just going to turn him around here. And you can see here is the vertebral column, and we'll talk about these spinous processes. I go through them in detail for you. But at the very base, so this is all, again, part of the axial skeleton. At the very base of the vertebra, and of course we have the cervical vertebra and the thoracic vertebra and then the lumbar vertebra. And so you'll go through, the easy way to remember how many are in each one are, you have 7 cervical, 12 thoracic, and 5 lumbar. So it's kind of like your breakfast, lunch, dinner. The time frames, like, I know it might not be when you eat breakfast, lunch, and dinner, but kind of on average. So that's how you can remember. You know, you might eat breakfast at 7, lunch at 12, and then dinner at 5. So you have 7 cervical vertebra, again, 12 thoracic vertebra, and 5 lumbar vertebra. And then you have your sacrum down here. So here is the sacrum. And you only have to know a couple parts to the sacrum. You can't see the sacral canal on this because I can't take it off, but if you were to look into this, you could see the sacral canal. And then it would run down here, and you would have an opening down around here called, again, it's not depicted well on this, called the sacral hiatus. The articular surfaces are covered on this sacrum because if you see, they're actually articulating, which is, I think, is kind of nice for you to see. So if you look in your lab book on page 109, you'll see the articular surfaces of the sacrum, and here you can actually see them articulating with the os coxa, which are the hip bones. So then there's the median sacral crest that will go down the middle here, sticking out, and it would be basically the spinous processes of the vertebra that made up the sacrum prior to being fused. And then you have the sacral foramina, which are going to be these openings here. So sacral foramina. Foramina is going to be a hole or an opening. And then you, of course, have the coccyx. So the coccyx, or your tailbone, is going to be right down here. So there's your coccyx. Here's your coccyx bone, or your tailbone. So if you ever heard someone say they broke their tailbone, it's the coccyx. So then we're going to go ahead and go here. I'm going to flip over, and we're just really briefly going to go through the thoracic cage. So for purposes of the thoracic cage, I don't think you have to know too much. You do need to know that the sternum is made up of, let me see if I can zoom in here, this bone up here, that's going to be called the manubrium. So this is the manubrium, and I wish I could I'm just going to move this up there. So I'm going to hold that up for just a second. This is the manubrium. Okay, so that's the largest portion of the sternum, is the manubrium. And then you have this portion here, which is the body of the sternum here. So there's the body of the sternum, and then of course this tip here, which is the xiphoid process. Don't let it trick you, it's spelled with an X, but pronounced xiphoid process. So those are the three parts to the sternum that you have to know. Manubrium, body of the sternum, and then the xiphoid process. Let's see. And then you have your ribs. So when we go through your ribs, you have 12 pairs of ribs here. Okay? So the first 7 pair are called the true ribs. So 1, 2, 3, 4, 5, 6, 7 here. And you can see that they're actually attached directly to the sternum with a piece of cartilage here. So we call that this part of the cartilage here. You can see it kind of in clear. We call that the costal cartilage. And then you're going to see you have the pairs 8 through 12. 8 through 12 are called your false ribs. So 8 through 12, you're going to see these ribs are actually coming in, and the piece of cartilage is actually attaching to the cartilage from that 7th rib. So they're all kind of coming in here and attaching. So they're not attaching directly to the sternum, and that's why we call them the false ribs, because they're not actually attaching directly. They're attaching to that last bit of cartilage, costal cartilage that we call it. And then, of course, your rib 11 and 12 are actually called your floating ribs. And let me move the handout here. And you can see why, because, again, rib 11 and 12 are not attached to the sternum at all. And I think that's it, other than, oh, you do need to know what's called the jugular notch, which is the notch up here. So sorry, I should have covered that when I did the manubrium. It's this notch up here. You can palpate it on yourself. So that jugular notch is on the manubrium. So you can palpate that on yourself and feel that. And I believe that is everything that you need to know for this up. So I'm going to go ahead and cut this off, and I will be back with the appendicular skeleton.